Hi, I'm Nancy O'Neill. What does aging gracefully mean to you? Well, it means something different to everyone. No matter what age you may be, Aging Gracefully on Suncoast FYI offers advice that could help you live a healthier life. Each week we hear from a variety of specialists on a wide range of subjects. So please join us for Aging Gracefully on Suncoast FYI. Joining me now is one of Sarasota's top cosmetic surgeons, Dr. Sessa. Over the next several weeks, he will share his insight and expertise on a number of treatments that are available through Sarasota Surgical Arts. Today's topic will be on the benefits of facial rejuvenation. Good morning. Thank you for being with us.
Thanks for having me.
Now, I know that all of our viewers want to jump right into what we're going to talk about today, okay, facial rejuvenation, but could you tell us a little bit about yourself and how you came to be in Sarasota?
Sure. So, I'm an Italian-American who grew up in New York, after graduating high school, I just kept moving further and further away from New York. Eventually, I made it down to Louisiana, where I went to medical school, as well as did my surgical residency. Then I went on and did a fellowship out in Utah and just in cosmetic surgery. And while I was at LSU in New Orleans, I met my now wife, and we now have 3 young children. I have 3 small sons. And we moved to Sarasota about 10 years ago. And that's when I started my practice. It's a solo practice. And really the way it happened is after September 11th, my family just decided that they did not want anything to do with New York anymore, so they moved to Florida. And I was away in school and residency and so on and so forth, and I decided that this was as good a place as any to raise a family.
To raise children, absolutely.
So we moved here, and we've been very happy here since.
Great. Well, we're happy to have you here.
Thanks.
Now, let's start. When should somebody consider getting a facelift? I know that's a very personal question. And what do you say to your clients that come in?
So, you know, that's a very personal question, just as you put it. So really, I never mention to people during my consultations, I'll never sit down and say, this is what you need. This is what I suggest for you. It's always, let's look in the mirror together and you tell me what it is that bothers you. So
I like that.
It's something that what bothers you may not bother me, and what bothers me may not bother you.
Yeah.
So I've learned a long time ago not to say what I'm bothered by. So if you look in the mirror, let's say you're 45 years old. I'm 45 years old. Let's say look in the mirror and you're 45 years old and you notice that you have a little bit of creasing or maybe some heaviness in your jowls, or maybe you're starting to get some looseness in your neck. So that may be time to maybe start thinking about doing something.
Okay, but
maybe not a full facelift,
right?
Right?
Maybe not a full facelift.
So, right. So, you know, when you talk about facial cosmetic surgery, it's all about how much something bothers you.
Right.
If it bothers you enough to correct it surgically, then you're ready to have a facial procedure done.
Okay.
I just want to just expand on that slightly, in that facelifts aren't one size fits all, right? Think of facelifts as a continuum. So early on, you have a mini lift to fix maybe minor things, minor issues. Then you have more of like a modified facelift, which is a little bit more aggressive to fix maybe some things in your neck, maybe a little bit more loose skin. And then you have a facelift, which is what I consider facelift, neck lift combined. A lot of surgeons separate the two, where you do facelift and a neck lift. But when I call it a facelift, just for all intents and purposes, think about face and neck all together. Because as far as I'm concerned, it's all one structure.
Well, I would think so. I would think if you're going to get your face done, you can't have all the wrinkles on your neck. Now, can you give us an idea how much younger you're going to look after surgery? And again, it
Sure.
depends on how much surgery you have done.
Sure. So I've done surgery on women that say that they look 30 years younger. I've done surgery on women that say they look 10 years younger.
Right.
15 is probably about the average that you could expect. And it's not just the surgical procedure. It's, you know, a lot of women bring in pictures. This was me when I was, you know, 20 years ago. This
Right.
was me when I was 15 years ago. No one brings in a picture and says, this was me last year.
Right.
You know?
They have to be realistic, though,
Right.
with what their expectations
Right. Yeah.
are and what you can do. And when you do this surgery, how long do the results last? I mean,
Yeah.
if they're looking for 10 years or 15 years, how
Yeah.
long can they expect that to last them?
So everything that I do is permanent. So technically, when you hear the word permanent, you think of about 5 years.
Okay.
But with this type of surgery, think more along the lines of 10 to 12 to 15 years.
Okay.
Really depends on where you were when you started.
Okay.
So if you were early on in that continuum, expect 15 years of solid results.
All right.
Now, I'm not going to stop the wheels of aging,
Right.
right?
Can't do that.
But if you took a picture of yourself and cut yourself in half, and one had surgery and one didn't, and then moved 15 years down the road,
Right.
the one who had surgery is going to look significantly better
Better.
than the one who did not.
Okay.
So think of cosmetic surgery in that sense. And it's okay to think, well, hey, you know what, I got this done in 8 years, 10 years, 12 years. If I don't like the little sagging or the wrinkles that I'm developing, I can do something,
again.
a mini or
Right.
maybe a mild tuck
Okay.
or something along those lines to get the result that I want.
That you wanted.
Yeah.
Now, whatever it is that you have done, and I'm sure this is a question that you will answer on a case-by-case basis,
Yeah.
but recovery time. I mean, obviously, if you have something smaller done, it's not going to be as
Sure.
time.
Sure. So I think I do a really good job in terms of recovery for most of my patients. I would say 95 to 98% of all my patients, within 7 days, they're pretty much ready to be out and about in public. You know, if you have a bruise here and there, you could always put a little bit of cover-up makeup on, but 95 to 98% of all the swelling will be gone by 6 to 7 days.
Awesome.
So what I generally tell my patients is, you know, how long are you going to be laid up in bed?
Right.
1 day, right? The
Excellent.
same day of surgery. The next day, you could be walking around. I've had patients tell me that they've gone shopping the following day. I don't like that,
Right.
but you know, the sooner you're moving around and the sooner you get to more normal routines,
Yeah.
the quicker you're going to recover.
That's right. Wonderful. Well, we have so many more questions to get to, but we will have you with us next week and for weeks to come, so we'll talk more about all of the procedures that you
Great.
do. Okay?
Sure.
Thank you so much for being here today.
Thanks.
Thanks. Stay tuned, and Aging Gracefully will be right back.